Hi, my name is Mary Jackman, and this is my current events project. This is my introduction into my current bioethical dilemma, the use of GLP-1 medications in older adults. A current bioethical dilemma is the use of GLP-1 medications in older adults. The Association of American Medical Colleges, AAMC, published the article, Are GLP-1 Weight Loss Drugs Safe for Older Adults? In December of 2025, highlighting important considerations of the usage of this drug in the older adult population. The questions posed by this article relate to my chosen bioethical issue, polypharmacy in older adults leads to higher mortality. I'm looking to explore the possible causation of increased adverse effects, specifically death due to polypharmacy, overmedication, or use of potentially inappropriate medications of adults age 65 and older. I'll focus on GLP-1 medications as an example of a current bioethical dilemma, as usage of this medication has increased 155% among type 2 diabetics from 2018 to 2022. I'll present current publications on this topic, explain its relevance to my current career path, define bioethical principles, seek guidance from the Nursing Code of Ethics, determine ways I can advocate for health policy changes, and leave enough room for discussion. Moving on to the article analysis. This article from the AAMC, written by Bridget Balch, features insights from several medical doctors, including 2 gerontologists and an endocrinologist. First, gerontologist Dr. Chitra Gancha states that GLP-1s have improved management of metabolic disorders such as obesity and diabetes and increased patient and provider hopefulness for effective treatment. However, Dr. Ganta takes extra caution in the older adult population, ages 65 and older, due to an association between weight loss and mortality from all causes, particularly for males who lose more than 10% of body weight. Professor of Geriatric Medicine, Dr. John Batsis, supplements this concern by pointing out that the lack of GLP-1 clinical studies that include substantial amounts of older adults. Dr. Thomas George describes that patients on GLP-1s are effectively losing weight and improving diabetic control, and inquired about the influence of this drug on cancer risks. Dr. George concludes that older adults experience fewer cancer protective benefits than younger patients, but calls for further research into the effects of GLP-1s in minimizing cancer risks. Dr. Ganta posed similar questions regarding conditions such as sleep apnea and dementia, asking if reduced obesity causes an inadvertent improvement of these conditions or if the medication itself directly improves a condition. Both Dr. George and Dr. Banta hope to see further research into studying the mechanisms of GLP-1s on various diseases and conditions. Lastly, endocrinologist Dr. Ruchi Gaba believes that diligent consideration of a GLP-1 medication depends on a comprehensive review of the patient's health and concurrent prescriptions. She prioritizes the patient's function and quality of life and considers if the benefits, such as weight loss, outweigh the risks, such as potential loss of muscle mass that may contribute to a greater risk of adverse outcomes. Dr. Gaba's considerations coincide with Dr. Batz's concern for lack of clinical study data that included older adults, as well as inclusion of a 2018 analysis of current clinical trial data by Warren et al. That concluded that older adults discontinued the medication at higher rates than younger patients due to gastrointestinal issues. Overall, the suggestions from these subject matter experts demonstrate benefits from a GLP-1 medication in older adults, the necessity of careful consideration of potential adverse effects before prescribing the medication, and need for increased inclusion of older adults in research studies, as well as longitudinal follow-up. Impact on my career path. As people live longer and technology and medicine advance, polypharmacy is a justifiable response to multiple chronic conditions. However, the increase in medications creates opportunities for drug-to-drug interactions that have not been extensively studied. Older adults already face changes in pharmacokinetics, altered absorption, metabolism and elimination, and pharmacodynamics, altered sensitivity of medications. Older adults are more vulnerable to the adverse effects of polypharmacy, which increases the importance of regular reassessment of risks and benefits of medications with consideration for patients' age and comorbidities, both chronic and new. My intended career path is to be an adult gerontology nurse practitioner in the field of oncology. The concept of polypharmacy is highly relevant in gerontology due to its prevalence. As new drugs, such as GLP-1s, hit the market, providers must be highly educated and cautious about the efficacy and safety of these medications, specifically in the older adult population. Bioethical dilemma. To fully embrace the idea that potentially inappropriate prescription of GLP-1s in older adults is a bioethical issue, bioethics must first be defined and understood. Bioethics encompasses moral philosophy, cognitive psychology, communication skills, clinical medicine, and health law. Bioethics is a broad topic that studies the concrete or material aspects of medical and nursing practice, physical actions and laws, as well as the psychological concepts that impact healthcare, individual morals, and ethics. Additionally, there are four principles that bioethicists utilize when analyzing clinical situations: beneficence, non-maleficence, respect for autonomy, and justice. When older adults suffer harm due to polypharmacy or overmedication, as in GLP-1 usage, potentially, all four of these principles are compromised in some way. Continued. The duty of beneficence primarily lies in the obligation to do right by patients by facilitating improvements to physical or psychological well-being, whereas non-maleficence is a prevention of harm or risk to the patient. Without diligent, dynamic review of medication regimen, the prescription of a GLP-1 for obesity or health protective benefits does not constitute beneficence. If potential side effects and patient condition are not carefully considered before prescribing, the patient may not experience the intended benefit. In fact, this action can result in inadvertent non-adherence to the principle of non-maleficence due to harm that may occur. As described above, Warren et al. Determined older adults in the study can be prone to undernutrition, which can be exacerbated by reduction in body weight, at greater risk for hypoglycemia with concurrent usage of sulfonylurea and basal insulin, and greater risk of gastrointestinal intolerance of GLP-1s. Respect for autonomy may be compromised, as an increased number of medications carries the increased likelihood of mis- or under-communication of medication usage and potential side effects. Personal autonomy, the moral right of individuals to choose, may be compromised in polypharmacy, as pharmacological treatments are often favored over other approaches in today's healthcare systems. Essentially, polypharmacy may indicate a lack of choice by an individual to explore non-pharmacological interventions due to stress on and by the healthcare provider. On the other hand, spending on GLP-1 medications has increased by over 500% from 2018 to 2023, based on data from both retail and online prescription refills, which indicates that consumers may demand such prescriptions and, therefore, contribute to polypharmacy without insight or influence from a healthcare provider. Lastly, the principle of justice is the distribution of benefits and burdens of a social system in a fair and equitable way among all participants in the system. The findings of Varadian and Warren show a negligible difference in usage of GLP-1 medications from those with family incomes from less than 100% of the federal poverty line, 25.8%, to 400% of the federal poverty line or above, 29%. The Kaiser Family Foundation's findings of the 2024 statistic of obesity by race and ethnicity showed that the U.S. has a prevalence of obesity in 32.4% white, 41.8% black, 36% Hispanic, and 14.7% Asian, Hawaiian, or Pacific Islander Americans. The U.S. Centers for Disease Control and Prevention, or the CDC, described usage of diabetics who use GLP-1 injectables by 31.3% Hispanic, 26.2% white, 26.5% black, and 12.1% Asian, which shows somewhat equitable utilization of this medication in comparison to rates of obesity across race and ethnicity. However, the greatest gap in correlation of obesity and prescription of GLP-1 medications is seen in Black Americans. One can apply justice to this situation by first seeking to understand and mitigate causes of obesity with special consideration to each racial or ethnic group, and secondly, advocate for equitable treatment and consideration of GLP-1s in these populations. Nursing Code of Ethics considerations. The Nursing Code of Ethics provides resounding guidance on the issue of increased risk of mortality related to polypharmacy. Provision 1.4, the right to self-determination, outlines the four bioethical principles described above with respect for autonomy as a primary proponent of self-determination, as discussed above. Additionally, the analysis of Provision 8.3, obligation to advance health and human rights and reduce disparities, calls nurses to take heed of social, legal, and institutional inequities and poor social determinants of health that limit access to care. These samples of analysis from the Nursing Code of Ethics identifies important values of nursing practice and the call for action moving forward. Care policy. Healthcare policy and reforms are a crucial point of analysis and change for the issue of GLP-1 medication prescription. An article from the CNN News by Brenda Goodman was published titled, Poison Centers See Nearly 1,500% increase in calls related to injected weight loss drugs as people accidentally overdose. This article brings attention to the important issue of GLP-1 medication regulation as the medication semaglutide was approved by the FDA in 2017 and began gaining popularity from celebrity social media influence of Ozempic in 2022. These medications faced a shortage, and in March 2022, the U.S. Food and Drug Administration, or FDA, approved qualified pharmacies to make compounded versions of the drugs. At this time, accidental overdoses being reported to poison control centers quadrupled from 2021 to 2022. Illegal and unregulated online pharmaceutical retailers had taken advantage of the policy change and capitalized on it. Continued. These occurrences emphasize the importance of diligent monitoring and policy update relating to pharmaceuticals. The Prescription Drug Marketing Act of 1987, the PDMA, was last updated on February 19, 2026, and it was comprised of 21 U.S.C. 831, which outlined additional regulations relating to online pharmacies and telemedicine. Healthcare policy regulation is of utmost importance in keeping the American public safe. Discussion. The prescription of GLP-1 medications will only continue to gain popularity as the United States population ages, which emphasizes the need to address usage of GLP-1s in the older adult population. A few questions to prompt further discussion include, how can a greater number of older adults be included in pharmaceutical clinical trials? How does the American culture of treatment of older adults influence the inclusion of older adults in studies, and what can be done to change the current influence? How can the American public be educated on health and aging, and where can these changes be implemented? Schools, primary care offices, workplaces. Are there ways to ban or prevent unregulated online pharmacies without infringing on the rights of the American public? Should there be greater legal consequences for those who unknowingly or knowingly purchase prescription medications from unregulated online sources, or are potential medical consequences sufficient? The conclusion. To conclude, my presentation on the topic of current bioethical dilemma of GLP-1 usage in older adults with respect to my overarching research subject of increased mortality due to polypharmacy in older adults, I feel that there is compelling, multifaceted evidence that GLP-1s require careful consideration for the older adult population. GLP-1 usage in older adults is an increasingly prevalent instance today, and literature published regarding GLP-1s show that this medication does offer protection against all-cause and cardiovascular mortality. However, while there are many proven benefits to the appropriate prescription of this drug, providers must remain diligent in ensuring clinical trial data include substantial numbers of older adults, and studies are conducted on drug-to-drug interactions in the older adult population. The health benefits of new medications that can be experienced by older adults are hindered and still unknown if research is only ever conducted with younger participants. Additionally, it is of utmost importance to be diligent and skeptical of new medications, whether that be the mechanism of action of the medication in relation to the patient's condition or the manufacturer from which patients receive the medication. After a multifaceted review of GLP-1 medication effects on older adults, I've developed a greater understanding of how to be a provider who is wholly prepared to prescribe medications in the older adult population. These are the first half of my references. I wasn't able to get the hang indent, but here they are. And this is the second half of my references. And that's it. Thank you so much for listening to my presentation.